Will thymectomy help a patient with myasthenia gravis? I get this query on phone, on WhatsApp, on my mail every single day. And therefore I've decided to make a short video about the benefits of thymectomy in myasthenia gravis. Now, before we understand the benefits of thymectomy, we must understand what is thymectomy. So thymectomy is basically the removal of the thymus gland, which is a gland located between our breastbone and the heart. If you remove that gland and all the surrounding fats along with the gland, then this is a procedure which is known as thymectomy. Why it is offered in patients for myasthenia gravis? It is because it is believed that this thymus gland is the seat of production of antibody mediated disease. If you remove the thymus gland, which is the seat of the production of the antibody, you are going to be able to help the patient achieving long-term cure for the disease, and that is the thought process when we offer thymectomy to our patients. Now, whether it will help a particular patient or not depends upon a lot of factors. However, before we do that understanding, we must understand that myasthenia gravis may present in two forms. One form is where there is only myasthenia gravis and there is no tumor of the thymus gland, and in the other form there is myasthenia gravis and a tumor of the thymus gland, which is known as thymoma. Now, let me break out the myth right in the beginning here that those patients who have myasthenia gravis with thymoma, they do not have a choice for surgery. They have to undergo surgery because thymoma is a locally aggressive tumor. A lot of people believe that this is a benign small tumor and can be left alone, which is very far from the truth. It can invade surrounding structures, which may include heart or the lung, and it can become very big in size also, and therefore if a thymoma is found, it always has to be removed by surgery, and therefore thymectomy or radical thymectomy is an essential component of treatment of thymoma. On the other hand, there is a group of patients who are myasthenic or have myasthenia gravis, but they do not have a thymoma. Here the initial treatment usually involves the symptomatic treatment and immunomodulator drugs to control the disease, and once the disease is adequately controlled, for achieving long-term improvement, thymectomy is offered. Now, which patients or how many patients will they benefit from thymectomy? We explain it in terms of 1/3, 1/3, 1/3 rule. In 1/3 of the patients whom we offer thymectomy, there will be a significant improvement on symptoms, and over a period of 3 months to almost up to 2 years, there will be a slow reduction in the medications to the point that where they will not require any medications, and which is known as a complete stable remission. So 1/3 of the patients will get cured or will go into a complete stable remission after thymectomy. There is another 1/3 group of patients who will benefit significantly. Now, what does it mean? It means that their symptoms will become much better. Minimal medications will allow them to lead their normal life, and it is important that harmful medications like steroids, which are harmful over a long period of time, it will be easier to taper them down to acceptable doses or completely remove them. So this is another 1/3 group of the patient who will have significant improvement. And so if you look at this 1/3 and 1/3, so nearly 60 to 70% of the patients will benefit after surgery from myasthenia gravis, and there will be a small group of 1/3 patients who will not benefit from surgery, and their myasthenia will either remain the same and sometimes can also progress. So this 1/3, 1/3, 1/3 rule answers that question. Now, how do you understand which patient should undergo? So in usual we say that any patient who is in the age group of 18 to 60 years who is an ACH antibody positive, seropositive myasthenia gravis, and has been diagnosed early, is going to benefit from thymectomy, and these are the patients whom thymectomy should be offered. And sometimes it is also offered in patients of ocular myasthenia, where only the eyes are involved, when the disease control is not adequate by just medication, or it is progressing to generalized myasthenia.